Welcome to our podcast series, Conversations Around Breast Cancer. My name is Laurie Ann and I have Dr. Ettienne Myburgh, our oncology surgeon, with me from Panorama Center for Surgical Oncology. So last time we discussed mammography and self-breast examination. Dr. Ettienne, give us a short recap on what we discussed last time.
Yeah, thanks, Laurie. To summarize, the most important message was that women should get to know their breasts. You shouldn't have a burden of, every second week of the month I have to examine my breast, but I think it's good that you have an awareness of your breast. And then in terms of mammography, my suggestion was that one should have a risk-adjusted approach to screening mammograms, which means that you need to know and understand your risk. And if you are an average risk or a normal risk, then you can probably have mammograms maybe starting at 50 and have them less often. If you have a moderately high risk, you should probably start earlier and have them yearly. And if you have a very high risk, then you should probably have genetic testing and maybe even do things like MRI. I think the last thing that people tend to forget is they think if they do a mammogram, they don't have to have a breast exam. And in reality, a clinical breast exam is as important as a mammogram. And it is important that people go for those even before they start mammograms. So if I have to recap what we said, I think that's about that.
So if you missed our previous podcast, you can go to Spotify, Podbean or Apple. On those three platforms, you can check out Conversations Around Breast Cancer and listen to our previous podcast. Tonight, I'm excited. We are looking at risk factors. What you can change, what you can work on. Can you change anything? Can you modify it? Can you not modify it? But the first question I have, Dr. Ettienne, is if you go onto the internet, you will see, if you Google, what is my risk factor to get breast cancer? It'll come up something like you have a 1 in 8 chance of getting breast cancer in your lifetime. Is that a global statistic or is that also applicable for South Africans?
So I think the important thing to understand is breast cancer is the most common cancer that women get. It is not the cancer that kills the most women. So incidence-wise, yes, definitely the most. But it does vary a lot from different countries and different population groups. So if we look at countries like the Netherlands and Germany, they have a much higher incidence of breast cancer than South Africa. And some of the African countries, for example, have a much lower incidence. So in South Africa, we don't actually know exactly what the risk is of getting breast cancer because we have a lack of data. So we don't have a very good cancer registry. We don't have data collection sets where we look at people over the course of their lives to know how many people exactly get breast cancer. But we think in South Africa, the risk is probably somewhere between 9 and 11%, probably closer to the 11% mark of getting breast cancer. It depends a lot on the population group that you're in though. So if you are from Afrikaner descent, remember that gene pool comes from Germany and the Netherlands. So then obviously your risk is going to be higher. If you are from Ashkenazi Jewish hereditary, then your risk is going to be even higher than that. If you are of Xhosa descent, then your risk is going to be a lot lower. So because South Africa is such a varied community of people, we have vastly different risks for those different population groups.
So there you touched on the non-modifiable risk factors, which is the ethnicity. So what other non-modifiable risk factor can you add? If I look at gender, women get it more often?
Yeah, so if you think about risk factors for developing breast cancer, the first thing I want to say is there isn't like this one thing that causes breast cancer. A lot of women come and see me and they feel guilty because they did this or they didn't do that or they didn't have enough children or they didn't breastfeed or, whatever the thing is that people feel guilty about. We tend to want to assign guilt and causality to things. So we somehow feel a little bit better if we know, okay, this is the reason this happened. But the reality of life is most things just happen. So your risk of getting breast cancer is a conglomerate of lots of small things, some of which you can control, some of which you can't, that all then build up to this risk. And I think the problem with statistics often is that if you tell someone, listen, you've got a 10% chance, they may feel, okay, it's low or high, it doesn't matter. But the reality is the person that gets breast cancer, she got it 100%. And the person that didn't get breast cancer, she got it 0%. So for the individual, it doesn't really matter that much what your risk is, because if you feel something, if there is something that you are concerned about, whether you have 0 risk factors, if you investigate that and you find it's cancer, then you have 100% cancer. I think people tend to sometimes say, but I don't have a family history of breast cancer, therefore I don't have to worry about this lump. Or the doctor said I only have a 10% chance of getting breast cancer, therefore I don't have to worry about this calcification on the mammogram. That's completely untrue. You have to deal with whatever you get confronted with. So from a risk factor perspective, we can talk about those things that you have control over, and then you can talk about those things that you don't have control over. Obviously, if you don't have a breast, you have a very, very small risk of getting breast cancer. If you're a man, you don't have a breast. You do have a breast bud. So that's why men have 1% of the risk of what women basically have. They have 100-fold less risk because they don't have a lot of breast tissue. Things that you don't have control about would be, for example, your family history. If you have a mom who's had breast cancer and an aunt who's had ovarian cancer and you have an uncle that's had pancreatic cancer. So the more prone your genetic makeup is to develop cancer, obviously the higher your risk would be. Now, certain genes would push that risk up a lot. Typically, we talk about the BRCA1 and 2 genes, or the BRCA genes. But there are actually quite a number of high-risk genes, ATM, PALB-B2. So these are all genes that increase your risk tenfold almost to get breast cancer. So if you do have that faulty gene in your family and you inherited that gene, maybe we can have a podcast about genetics, I'm sure we will, then that will put you at that very high risk. Now, you can't change that. You can do things to live healthily and to, whatever, but you're never going to get rid of that risk by just doing things about your lifestyle. Other things that you really can't control, let's say the age at which you started menstruating. Theoretically, we'll say that girls who start menstruating before the age of 12 will have double the risk of getting breast cancer versus someone that starts menstruating after the age of 14. Now, you can argue whether that's a modifiable thing or not. There's very interesting data in the United States. In the 50 states, there was a 10-year gap between where television was introduced the first time in some states up until the last states that got television. And you could see that the girls in the states where television was introduced started menstruating earlier than the ones that didn't have television. And we could also see that the breast cancer numbers rose sort of 25 years later in those states which had television first versus the one that got television later. Now you might say, so television is causing breast cancer. No, television introduces a certain lifestyle modification. So you look at adverts of, sexy ladies selling cars or whatever the case might be, and looking at these sensual visuals switches on your control system for telling your ovaries to start working. So it's just one little thing. We can't really change that very much. We live in a society where multimedia, but I think it just, again, if you're a parent, you should think carefully about what do I allow my child to look at? And am I switching on her hormonal state earlier than what it really should be? These are all things that you really don't have control over. In theory, patients that are taller have more risk for breast cancer than those that are shorter. We'll talk about things that you can modify. So the reality is there are some things that you really can't make a big, you can't change that. And it's good to know about that. But, my feeling is always, what is the value of knowing something if you can't make any, if you can't change that? So, yeah.
I've also heard not breastfeeding. Why would it be a risk?
I think the whole issue of breast maturity comes into play. When you develop through puberty, your breasts start developing. But that breast tissue stops at being an immature breast until you physically have a baby in your arms. So if you don't fall pregnant and you don't have a full-term pregnancy, then your breast actually remains immature And everything that influences that breast in terms of, let's say, cancer risk will have probably about a 70% impact than the same scenario if you have a breast that's already mature. And this now goes to things like alcohol use and smoking and being obese and things like that. Now, you asked about breastfeeding. Part of the whole thing of how does pregnancy and breastfeeding protect you from breast cancer is firstly because it allows the breast to become mature and not be an immature breast. That benefit seems to fall away around the age of 30. So if you don't have a full-time pregnancy before 30, then it doesn't seem to make a big difference in terms of protection against breast cancer if you then have a first pregnancy later on. In terms of breastfeeding, there's some evidence that says if you breastfeed for prolonged periods of time, and it seems like that should be about 2 years. So if you breastfeed for a long period of time, it has a protective effect. It doesn't really make a big difference if you breastfeed for 6 months or a year or something like that. So pregnancy before 30, that has a protective effect. Doesn't make a big difference whether you have 1 or 2 or 5 children. Doesn't seem to make a big difference. And the second thing is then breastfeeding for a prolonged period of time does seem to have some protective effect, yeah.
Then I've also heard if you have menopause at a later age, could that increase your risk?
Yeah, so think about the amount of time that your body is exposed to high levels of estrogen. So estrogen, remember, is the thing that makes you develop a breast. It is a growth stimulant to the breast. That is why the majority of breast cancers also understand that if they increase their sensitivity to estrogen, that they can grow faster or better. So most breast cancers, we say, are estrogen sensitive. So estrogen per se does not cause breast cancer, but prolonged periods of exposure. So if you start menstruating at 9 and only have menopause at 54, then it means you've had a much longer period of exposure than someone that started menstruating at, say, 15 and had menopause at 50. Now, probably that first couple of years has a much bigger impact than the 2 or 3 years that you have a longer menstrual cycle. But I think that's if you think about how it works in terms of breast cancer, it's about how much hormonal exposure your breast has had over the course of your lifetime.
Another question I have is hormone replacement therapy. Your doctor wants to put you on HRT. Does that play a role in a risk to develop breast cancer?
So we used to think so, and then there were 3 fairly large studies that looked at the epidemiology. In other words, it looked at following women for a very long period of time throughout their life, and then looking at those that used HRT versus those that didn't. And I think the interesting thing about those studies were that patients that used HRT up until the age of 60 really had a negligible effect on their risk for breast cancer. If you used a combination, something like a progesterone and estrogen combination, then it did increase the risk, but we would see sort of 2 extra breast cancer patients in 1,000 women over the course of 10 years, so it would be a very small bump in that risk. Estrogen alone does not seem to increase the risk for breast cancer. Now, if you continued using HRT, let's say until 70 or 75, there does seem to be some concern that it may increase your risk. It's not going to make your risk of dying of breast cancer any higher, but it does seem to increase the risk a little bit. I think the concern with HRT is, remember, inherently it makes your blood a little bit more clottable. So your chance of getting blood clots or strokes or heart attacks does increase a little bit. And in principle, my advice to my patients would be that you should really try and see if you can get off the HRT around the age of 60.
So now you mentioned that the longer that you menstruate, the greater the risk for breast cancer. So if you go on the pill, will that reduce your risk?
It's a complex answer. The first thing is it's not about menstruating. Remember, the fact that you maybe don't menstruate doesn't mean that you don't have estrogen. And I think a good example is maybe the intrauterine device that has progesterone in it. I think in South Africa, people commonly know it as the Mirena. Now, there's more than 10 research studies that have looked at patients that have had at least one of these devices. And in all of those studies, there's an increase in breast cancer risk for those patients. It seems to be, if you have one device for, let's say, a period of 5 years, it probably increases your risk by maybe about 19 to 20%. Now, if you have a global risk of 10%, then it means it adds about 2% to that. If you had a risk of 20%, it would add about 4% to that risk. If you had a second device placed, that risk then bumps up to about 43%. So that starts becoming a significant amount of risk that you add. So I think that is the concern. Now, those people generally don't menstruate, so I think they have a false sense of security. Now, I do want to mention that they have a lower risk of ovarian cancer. Now, the problem is, if you have less than 1% risk of ovarian cancer and you halve that risk, then, it makes such a small difference that it's not beneficial really. But because breast cancer is common, we see that more frequently. I think the other thing that comes out from that research data is that normally we'll see 80 to 90% of patients will have ductal cancers, the type of cancer that they have, and then we have about a 10% chance of having a lobular cancer. Now, in patients who has had those intrauterine devices, we now all of a sudden see a 70% increase in the number of lobular cancers. So instead of 10%, it now becomes 17%, which is a significant amount. So that, I think, is something we didn't expect, because obviously, remember, the contraceptive pill was developed back in, I think, 1968. And the idea behind the pill was that women could then spread their children a little bit. After the Second World War, women, started working a little bit more, and they wanted to have fewer children. They didn't want to have, 2 children in 1 year. So the pill allowed them to spread their pregnancies. But it was never really designed to be used in people that haven't had children yet. So the original research said, no, it doesn't increase the risk of breast cancer. But if we look at the pill in patients who are young that hasn't had children and that have used that pill for longer than periods of 5 years, it does seem that it does increase your risk for breast cancer a little bit. And then when you stop the pill, that risk generally sort of then dwindles down again after 5 to 10 years to about a normal level again. But that does beg the question, should you be using the pill for your pimples when you are 13 or 14 years old and stay on it until you have your first child at 32? So I think we don't know, because none of the research studies that have been looking at these things have actually included that scenario in its design.
Another risk factor that I've read about is weight, obesity. Can that increase your risk of getting breast cancer?
Definitely. Being overweight increases your risk for breast cancer. It increases your chance of dying of breast cancer if you do get breast cancer. It reduces your chance of responding appropriately to medication for breast cancer. So obesity is a well-known independent risk factor. Probably for different reasons. I think firstly, fat cells tend to make a little bit more estrogen from non-ovarian sources. Number 2 is the liver's ability to break down the estrogen seems to be a little bit worse. And so those patients have a bit of an accumulation of breakdown products from estrogen. And then I always say things comes in a package. There's data that says if you have a professional career, if you're a lawyer or a doctor or whatever, your risk for breast cancer is higher than if you are, let's say, a teacher. But it's not the job that gives you breast cancer. It's the fact that when you are that person, you can't have 6 children by the time you're 30, and you can't breastfeed for 2 years, and you're probably going to be on the pill for a prolonged period of time, and you're probably going to have an intrauterine device, and you're probably going to drink 2 or 3 or 4 glasses of alcohol per week. So it's a package that comes with a certain lifestyle. Obesity tends to come with a package of not living a healthy lifestyle in general, not exercising as much, those type of things. So obesity is definitely an independent factor, but it also comes with a package that increases your risk.
You mentioned alcohol consumption can increase it. Why?
You can tell someone they have breast cancer and they are a little bit disappointed, but when you tell them they shouldn't drink alcohol, it's like, oh man, I can't believe this is happening to me. So it's always interesting to me how people have been brainwashed to think that alcohol is actually supposed to be part of a normal life. Now, Alcohol is 100% a cancer-causing chemical. If you drink 2 glasses of alcohol per week, you have a 30% increased risk of skin cancer, for example, because alcohol gets changed into formaldehyde, which gets excreted in your sweat. So there's a linear risk. The more alcohol you use, the higher risk for breast cancer goes. And the same with if you are on treatment for breast cancer and you continue to consume alcohol, you decrease the chance or you decrease the benefit that you have from your treatment. So alcohol, number one, is a cancer-causing chemical. There's no good way of getting rid of that. And the more you use, the higher your risk will be of getting cancer. And I think that's the short answer. Now, there isn't such a thing as a safe amount, because there's no amount that I can say, okay, this doesn't cause any issues with risk. But in theory, what we'll say is if you consume less than 6 units of alcohol per week, so that theoretically would be, let's say, 2 glasses of wine, that is maybe 100 milliliters. That probably doesn't increase your risk very significantly. I think the problem with alcohol is people tend to always drink a little bit more over time. They start with 1 glass a week, and then it becomes 2, and then it becomes 4. And the glasses you buy, especially in South Africa, isn't like a 75 milliliter little glass. So people tend to consume too much alcohol, and that is most definitely an unhealthy lifestyle choice.
And I suppose with the alcohol consumption comes the weight gain, and then you're just adding one risk on top of the other.
Yeah, as I said, everything comes with a little package with it. You very seldom get someone that does everything really well, but drinks a glass of wine every night, So I always tell my patient to say that alcohol is something that you use on an occasion, and the sun going down is not an occasion.
Physical activity, Dr. Ettienne, does that contribute?
It protects you, so it decreases your risk. So if you exercise 3 times a week, 45 minutes, moderate exercise, so in other words, you are out of breath and your heart rate is up, then it does decrease your risk for breast cancer. And the same goes for responding to treatment. If patients exercise regularly, then they respond better to treatment. So definitely exercise is a beneficial thing, and it doesn't have to do with weight loss. You can't outrun a bad diet. So exercise is an independent beneficial factor for you.
And then I've got another one, smoking. So people, I suppose it's all about this lifestyle where you can stop but you don't want to. How does smoking contribute?
So smoking is a general, I don't know what to call it. It is probably one of the worst things that humans have invented or started using. There's some data that says that smoking contributes up to 70% of our health expenditure. So in theory, if we didn't have tobacco, all of us would pay 70% less for our health coverage. So smoking, in each tobacco leaf, there's probably about 131 cancer-causing chemicals. So it causes anything from bladder cancer, it increases breast cancer, colon cancer, lung and tongue and throat cancer, and esophageal carcinoma and pancreatic cancer. So the list of bad things that happen when you smoke is really long. So my message is you should never smoke, because there are some processes where when you start smoking, you switch those on in your genes. And even if you stop, you can't switch all of it back off. That's the first thing. But I would want to say that it's never too late to stop. If you're 80 years old and you've managed to survive this long, you will still have benefits from stopping. I have a fairly high percentage of my patients that stop smoking because I take an effort to talk to people about smoking. Smoking is not really a physical addiction like alcoholism or, drug abuse or whatever. So if you stop smoking, you are not going to go off your rocker and end up in a mental institution. It's like a baby that sucks a dummy, and if you take the dummy away, the baby is going to be upset because it taught itself that when I'm feeling apprehensive or whatever, then I suck this thing that has nothing in it that actually has a physical effect on me, but I feel better. And smoking is exactly the same. So you can stop smoking. My patients that stop smoking are the ones that walk out of my office and throw the cigarettes in the dustbin. If I see someone 2 weeks down the line and say, oh, Dr. Myburgh, I'm doing a lot better, I'm smoking only 2 a day or whatever, I know for sure that person will not stop. Because if you tell your brain it's okay because you're doing so much better than last week, that is just an excuse to continue, and over time you'll continue smoking more again. So smoking is bad for everything. It's bad for you getting cancer. It's bad for you surviving cancer. It is bad for you having complications when you need treatment for cancer. So it is one of those things that you really should avoid at all cost.
So the tick list is long. So if I look at myself now, so I'm a woman and I was 40 and I had a mom. I didn't have genetic mutation. I am Afrikaans. I consume alcohol. Then I have quite a few. Oh yeah. And I didn't have children and I started menopause late. Then my tick list is quite long, but I think we wanted tick list to say the chances of me getting breast cancer is so much, but we can't. The fact that I have so many risk factors, I couldn't foresee it in the future that I was going to get breast cancer. But I think the combination, just put me in that risk group. And stuff happens to people.
So I think you should not follow a healthy lifestyle because you want to try and not get breast cancer. I think that's the first thing. You should follow a healthy lifestyle because of the benefits that it would give you over the course of your lifetime. A patient that lives a healthy way, when they get breast cancer, they will do better. A patient that lives a healthy lifestyle, if they need a hip replacement at 70, they will do better. So, my philosophy is simple. It's one of what type of a 70 or 75-year-old do you want to be? Because your physical body can sustain a certain amount of abuse, but the ability of that body to carry you when you are 75 is going to be different. So it's not difficult to still be able to do stuff and, get away with stuff when you're 40 or 45. It becomes a problem when you are older. The second thing I want to say is, even if you do everything perfectly, you're still going to have, let's say, ballpark 1 in 10 chance of getting breast cancer somewhere in your lifetime. So you can never get rid of that risk per se. I think it is a good idea to think about what are the things that I'm doing in my life that are destructive. And with my cancer patients, I often have this talk about, are the things in your life adding value to your life, or are they consuming time and energy and joy from your life? Because reality is that if you have lots of stuff, if you have a big house, it means it needs to be cleaned and it needs to be insured. It takes up time and money because of that. If you have 5 cars, again, those things all require attention. So you end up living to serve the things that you have. If you have relationships in your life that are consuming joy and energy from you, the question is, how much value does that add? So you live a healthy life because it adds value to your life. It doesn't add value to worry about whether your risk is 14 or 15 or 16% to get breast cancer. Because as I said, if you don't get breast cancer, it's going to be 0. And if you do get breast cancer, it's going to be 100%. So you live your life in the best possible way and you anticipate that things can happen. You can get breast cancer. You can have a heart attack. You can be in a car accident. And if that happens, I want to be in the best possible position to deal with that thing that happens with me. And I think that's the solution of living life without worrying unduly about the things that could potentially happen, because that will actually steal joy and time from you if you are living your life in this fearful way. So I think people that have a genetic reason for breast cancer, they can actually do something to bring that risk down. The rest of us, if you have a 15% risk of breast cancer, you're not going to be able to make a big difference on that risk, maybe 1 or 2%. But if you have a 95% risk or a 90% of getting breast cancer for a BRCA1 gene, and you decide to have a risk reduction mastectomy, for example, you can bring that risk down to maybe 3 or 4%. So there are some patients where they can really do something. And I think knowing your genetic status, if it is appropriate, is a really powerful piece of information. But for the rest, my advice is everybody should be living a healthy life. Everybody should be exercising because it benefits everyone. Everyone should not be obese. everyone should not smoke, and everyone should avoid alcohol. Those 4 things have universally, in lots and lots and lots and lots of trials, have shown to be the 4 things that are really the cornerstones of a healthy lifestyle.
Dr. Ettienne, you've given us a lot to think about, and I hope that the listeners out there understands the risk factors that you can and can't control much better. And we want to thank you. Yeah,
thanks, Laurie. It's great having these conversations. And I want to invite the listeners, if they want to throw a question into the basket, they can go on Facebook, social media. All of us have accounts there, Instagram. They can definitely post their questions, and we'll try and see how we can fit those into the podcast. So, yeah.
Thank you. We'll see you next time.
Bye.